Hello, everyone. Welcome to this 35th episode of YVI, the YVI podcast. I am Dr. Monique Y. Wells, coming to you direct from Paris, France. And I am the founder and CEO of the Wells International Foundation, which is the nonprofit based in Houston, Texas, that brings you the YVI podcast. YVI stands for Youth Veterinarian Initiative. And our entire purpose is to introduce Black and Brown youth to the field of veterinary medicine and other fields that are animal focused, animal oriented, to expose these youth to the possibilities of working in these fields and to introduce them to people who look like them, who are actively doing these jobs and enjoying themselves and dealing with everything that comes with working with animals today. So I am excited to welcome to today's call Shawntaye Thomas-Dalton, who is a licensed veterinary technician. And I'm going to tell you just a little bit about her before I turn the camera or whatever it is over to her. So Shawntaye is, well, she began pursuing her career at the age of 14, all right? I'm not sure I'm gonna say this correctly, Calcasieu, that's the way that it would be said in French, Parish Animal Control Center in Louisiana. And when she finished high school, she took animal science courses and sheep production and agricultural economics at a school called McNeese State University. And then she moved to Houston, where she began her studies in veterinary technology. And I am going to share my screen so that you can see. Hold on. So that you can see. Shawntaye, this is the graphic that we created to promote this podcast. And you're standing there and you're looking very pleased with yourself. And you have a little bird on your hand. So I'm going to turn it over to you. Let me make this full screen. Just hold on a sec. I'm going to turn it over to you and let you tell us, just finish presenting yourself and tell us about what you're doing in this picture.
Well, hello, everyone from all across the world and the Youth Veterinary Initiative. I'm actually excited to say that I'm part of the 35th episode. I'll be 35 this year. So
oh, fantastic.
Yeah, this is divine. And so I am a licensed veterinary technician. I am recognized as a ER veterinary nurse within my hospital, and I am here pictured with a Quaker, a Quaker parrot by the name of BMO, and he was actually my coworker's pet that came in just to hang out with us in my Mercy Hospital. I currently work with Veterinary Emergency Group in DC, the Georgetown location. And in this picture, I call it like our intentional pose picture. We are both intentionally posing in this picture. But I will have to say that this is also a form of a memorial picture, because that beautiful little spirit is no longer with us, unfortunately. So this is BMO at the time where he was being cute, I would say, in emergency. And then that's the way of animal medicine and animal science. Part of the mission of the hospital I work with is helping people and their pets when they need it most. And at this time, I was able to see my coworker, who's a pet owner, in a different light when she then had to return to our hospital in regards to BMO's transition. Mm-hmm. So yes, I started in this industry, actually studying in this industry at 14, I started at the Calcasieu. In Louisiana, I was taught to say Calcasieu. I'm not originally from Louisiana. So when I say Calcasieu Parish, it may sound weird. But yes, at 14, I was able to start a program, summer school program, where we were able to experience, just get like that first taste of experience in the industries that we had passions and desires for. I appreciate my mom for putting animals in front of me since I was younger. I will go back before the age of 14, but I'm gonna start at 14, where I was exposed to animal husbandry. When I started, it was about keeping cages, patients clean, making sure that they are fed. And that is when I started with just the observational skills of what it means to be a veterinary technician, a veterinary assistant, a veterinary nurse, or just a person in staff. Even our receptionists, like everybody in the hospital is observant of our patients. And that's where I started, is just knowing behavior. I was able to experience at that age fearfulness and discomfort of pets, what may look like anxiety, what may look like anger and defense, what may look like pain, what it meant to have to maybe sit with a pet and engage them to be able to eat. Those things were things that I was exposed to in the very beginning at the Animal Control Center. Well, in Louisiana, and when I started college, thinking that I was going to be a veterinarian.
Okay.
To be honest, I started at Macon State in animal science. I was 17 when I started college. And I say that because I just wasn't, when I started college, within a year of me starting college, I also started a career in radio. So my
Okay.
focus was different.
Okay.
I was in school
Uh-huh.
and I was able to like put forth effort in classes that were interesting to me, but I didn't know that as a young person, I don't care if you look at your course syllabus and how many credits you need in college. I just was like, I came here to learn how to work with animals, and y'all have me in English 101. You have me in biology yet again after I've already taken biology in high school. So, mindset. Later on, I'll be dropping nuggets about my mindset and how it created limits and obstacles throughout my career.
Okay. All right.
Um, and so my mindset was one that some would say is very reflective of the youth today. They want it quick and they want it now.
Okay.
And they may want it without effort. And that was the ego that I went into college with, is like, okay, I will or won't participate in this art appreciation class. I
Okay.
will or won't participate in this what were some of the other classes I had to take? The electives that just had nothing to do, in my opinion, with becoming a veterinarian. So needless to say, my college experience, I had that mindset, but on the other side of it, I was also disappointed in how things manifested in my college career. And I made a pivot when I noticed that I just wasn't doing what it required to be a veterinarian in college, or what it meant to complete my agricultural science degree or my animal science degree. I Something in me still said that I still want to work with animals, but what are the other avenues
Okay.
in the animal health field? What can I do with the experience that I've gained? Because in college, even though I did not like my elective classes or my general studies session, when I got into classes like my like plant medicine classes where my college had a farm. So McNeese State University has a farm. So I did
Can
swine
you tell us what that
production.
is?
It's in Southwest Louisiana, Lake Charles,
Okay.
Louisiana, McNeese State
Okay.
University.
Okay.
And so we had a huge department. And in that huge department, we were exposed to, we had a field, a farm that was right next to us, or a plot of land next to us, where in my plant science classes, we were able to start planting seeds and grow our own vegetables. There was a chicken coop right there, right outside of our building. And then we would travel to our large farm where we had cattle there, we had swine there, we had sheep there. And that was my first experience. So I'm originally from Maryland,
Okay.
Prince George's County, Maryland. Lived in the suburbs outside of DC, spent time in DC. And so to go to Louisiana and then to become an agricultural science student, like the farm industry, like that was completely different and new to me. I mean,
Okay.
uh, again, while I was in college, I was in radio, a pageant girl, modeling, and did all those things. So I had to let go of all of those things to get in the mud, get down and dirty
Mm-hmm.
with sheep.
Mm-hmm.
Um, and I learned how to castrate sheep through that, how to castrate cattle, the different instruments, the manual ways of doing those things, the mechanical ways of doing those things. And while I was going through this experience, I didn't see anybody that looked like me
Mm-hmm.
in that
Uh-huh.
department.
Uh-huh. It's precisely why we do these interviews, because we want our youth to know that often you will be the only person of color and you can persevere.
You can. I will say that, and perseverance doesn't look the same for
Mm-hmm.
everybody.
Mm-hmm.
And I want to make that clear because I was being self-destructive when I felt like I couldn't persevere through the experiences that I had. Now, number one, again, I made sure I held myself accountable for not applying myself in the way that I should have.
Mm-hmm.
But I was looking for assistance and mentoring in a department of people that didn't look like me, that most likely did not know how to connect with me, how to guide and how to lead me. And I had an academic advisor after years of seeing me switch classes and do all these things. Instead of asking me what's really going on in my life and or what do I need, that advisor said that they would hold their breath until it was time for me to graduate.
What?
Yeah. That my advisor in their cowboy boots with
Oh
their hat
God.
on. And so that was a a painful experience. It was like where two things happened for me. Uh, Part of it was self-inflicted. So that me looking at myself in a lowly way added to what then I realized I was being seen as.
Mm-hmm.
And from there, I changed my advisor
Mm-hmm.
um, because like I knew that that wouldn't work for me, like that mentality um, or their truth
Mm-hmm.
was not going to be my truth. I changed my advisor and I spent probably another year to 2 years at that school in that program before I decided to leave Southwest Louisiana altogether because
Mm-hmm.
I was like, if this is part of the mentality at my college, um, this too is most likely the mentality of the people in my town.
Mm-hmm.
It's a small town. And even if I had that experience of work at the Calcasieu Parish Animal Control, it was not enough. And my college credits and things were not enough to create space for me, even to have a job as a veterinary assistant, veterinary technician in
Okay.
my town. So realizing that just being in a very limited thinking space was not for me.
Hmm.
Um, I left Louisiana in 2014. I applied to Pima Medical Institute for their veterinary technology program.
Okay.
And that's when I moved and transitioned there. I left radio.
Okay.
I was in radio for 8 years. I left radio so that I can eliminate all things that maybe would cause distractions
Hmm.
for me on my career path.
Hmm. Okay.
So some of those earlier pictures that we will later see in the slideshow would be
Hmm.
pictures of me with large animals.
Yes.
Those were my college days.
Okay. Okay.
The next probably phase of pictures you'll see, and you'll see my transition. I realize that I look younger now than I do in those pictures.
Let's go to some of those pictures. Hold on. Let me share my screen again.
Mhm.
Um, all right, so that's the first picture that we had, and these are not in any particular order. So
Okay.
you can tell me, Shawntaye. So let me see. My slide is not advancing. There we go. All right,
All
this is
right.
in the same space. So
Yes.
this is when you're in emergency care, right? Can you just tell us what you're doing right here?
Yes. So here I am admitting a patient. So the process of our patient's experience. When they come in through our doors, they are assessed through triage, and I'll explain more about triaging uh, throughout the process and what that meant throughout my career. But once they have a triage, the doctor comes and do an exam, and then diagnostics and treatments are like that next step. And so, if diagnostics show that a patient need greater observation and monitoring and hospitalization, then that is what you see next. I'm carrying out the orders as given by the doctor to admit patient to hospital. Um, Everything. And I learned that all of that rushing, all of those shortcuts that I was trying to do in college are not applicable here. I had to
Hmm.
actually slow down and think about the processes that I needed to do. So in this, in from left to right on the screen, you see that I am preparing all of my supplies, everything that it takes to do a aseptic technique. I can talk about that later on too, but aseptic technique for placing a IV catheter or intravenous catheter. Um, all the materials needed for that, all the materials needed to draw labs. So do um, phlebotomy and venipuncture and things. Those are like just terminologies I'm throwing out to the youth there.
Hmm.
Um, and then also, what you see me doing in the middle is drawing up in injectable drugs. This particular patient needed supportive care for vomiting and diarrhea. And so the picture of me in the middle is drawing up a anti-emetic, something to stop vomiting. And the last picture is after I did catheter placement. I am administering the injectable drug into the vein, into the patient's body, so that it circulates, so that it can help the body, excuse me, to get better and go through healing.
Okay,
Yes.
fantastic. Now, is this the same clinic?
This is the same clinic.
Okay,
Um,
different
this is
patient.
different patient. Yes, and actually different space. So the all the previous pictures you've all seen so far was in what we would call the main treatment floor of the hospital. The main treatment floor of the hospital will have patient exam tables, would have housing for our patients, cabinets where our supplies are. This particular space is our X-ray suite. This is where we do one form of diagnostic imaging. There are many types of diagnostic imaging. X-rays is one that a lot of us know of, but then there's also ultrasound, there's MRI, there's CT. We don't do the advanced ones there, but we do have our X-ray suite and our X-ray table here. X-rays, I learned, and that's what I love about what it means to be a veterinary technician. We wear many, many, many hats. um, uh, Sometimes that is where, this talks of being called a technician, being called a nurse. There's so many things, but I'm a phlebotomist. I am an anesthetist. I am a surgical assistant. I am a pharmacy technician. I am an X-ray technician. And here we have a cat that was presented for vomiting as well. This patient in particular. So I want to tell the youth, when things happen with our pets, we only kind of see what manifests outside. Well, to have an answer, to find an answer of what's causing the manifestation, we try to go in. And so there are different ways of going in. We talked about diagnostics. This is just getting a picture of your pets or our patients' bodies. So just before we did the X-rays, we are actually drawing labs. So you see my coworker and I administering restraint. So these are things that I learned in veterinary technology school. There are ways to restrain our patients safely in order for us to get our labs and our diagnostics, and in order to perform procedures. So this patient is being restrained for blood draw, and then the same form of restraint would help us take X-rays. Because of radiation, the space, that space is like full of like lead walls. The equipment, or the protective equipment, personal protective equipment that we're using, or what's also known as PPE, is what I'm wearing, so that I'm not wearing something just to wear it. I'm wearing it as a form of protection for my vital organs. You see that I have what's called a thyroid shield, which is around my neck, and it's also holding my locks back away from my face. And then I have on an apron. The apron is protecting the rest of my organs all the way down to my knees. So taking your time to plan for safety for your patients and yourselves is part of what it takes to be a veterinary technician.
All right. Let's go to the next picture. So
All
what is
right.
happening here? And what animal is this?
This is a puppy. And we've moved to a different part of the hospital. We are now currently in the isolation suite. Isolation is where we have patients that are contagious in some way or form, and we isolate the particular contagion so that it doesn't get spread in the hospital. And I am also wearing another form of PPE, or I should have just did like a quiz for the youth. PPE stands for personal protective equipment. The PPE that I'm wearing here is a gown, so that things called fomites, contagions that because I'm not able, obviously the patient is not contagious to me. The term is zoonotic when a pet and human gets infected from each other in some kind of way. So I can't get that, but I don't want these things to spread to the other patients that I have to assess in the hospital, which is why I'm protecting myself. So in this picture, we have a puppy that is dealing with a virus, um, and it's a virus that puppies that are unvaccinated become susceptible to. And in this case, what you see in the picture is that you see me with a syringe pump. There is a e-collar or Elizabethan collar
Mhm.
around the puppy's head because we're still a puppy
It's
puppying.
mhm,
I
mhm.
don't want the puppy biting out the IV catheter. I don't want the puppy gnawing at its feet or gnawing at the equipment that is being used, the IV line. So we put that on the patient as a form to block them from destroying things that are trying to help them. And what you see right next to the patient's eye, you'll see like this yellow or tan looking tube. That's called a nasal gastric tube. It's a tube that goes um, in through the nasal passage, passes down into the esophagus, and goes further down into the stomach so that we can administer feedings. And so there's a liquid feeding diet being administered to the patient in this picture. Um,
Okay.
Part of the many things that have manifested as a result of this patient's diagnosis means that treatment was like really intense. This patient was having diarrhea, and this patient wasn't eating even with appetite stimulants. So when things get to that point in emergency, we aid them in their nutrition.
Mhm. And the collar she was talking about, this blue, it's shaped, it's like if you had over your a cone around your neck with the mouth of the cone sticking up. So yeah, I used to like putting those things on. Anyway, let's go to the next. Let's go to the next picture. Now, you're in a different era now.
Yeah, this is definitely pre. Thank you, Dr. Wells. This is definitely pre now. This was my college days at McNeese State University in the ag department. And I am actually doing a ultrasound on a cattle in this photo. So you see me standing in the shoots, CHUTE,
Mhm. Yes.
uh, shoots enclose large animals so that treatment, tagging, and any various things can be performed safely. When you're dealing with I primarily work with small animals and exotics, some exotics, where restraint and housing your patients are different. But when you're working with large animal, uh, there are like huge machinery that aid you in keeping your patients still for things like this.
Mhm.
It's hard enough to talk to a dog and explain to them why I have to have them on their back in X-rays.
Mhm.
Imagine talking to free roaming animals to get them to stay still for a process. So at this time, I was performing an ultrasound to confirm pregnancy.
Okay. Can you talk
And
about the this plastic that's on your arm?
yes, that is, I'll call it a form of personal protective equipment. But
Mhm.
basically, it is a sleeve, a plastic sleeve that goes all the way up to my shoulders. And my arms are really long. So that is so that when I am using the probe to enter into the cattle, I'm entering from a space that isn't everybody's favorite. I'm actually entering into entering into a reproductive space, and I have to protect myself, and I have to protect her and the baby as well. So that is a sleeve, a plastic sleeve. That's left arm, and my right arm I'm holding the cord for the ultrasound probe, and the insertion. So learning animal learning about animal anatomy. So before I complained about biology, but
Mhm.
it was important when it comes to the type of work we do because I have to know my animal's anatomy to know where and positioning. Do I have to go? I'm going to use some directional terms. Should I enter into the reproductive space or part of the space to get to the reproductive space dorsally or to the back, like towards the back of the animal, or ventrally towards the belly and the underside of the animal. And so before I was even able to get the probe in to confirm pregnancy, I was actually able to touch the calf's head
Oh,
while I was in there. So that is part of that experience here.
all right.
Same day. Same day, just a different part here. I am with a little piglet, and this was after the castration of this pig during my swine production class. And again, I enjoyed this part of the experience because I don't know where the nearest farm is located here in Maryland.
Okay. Okay. So you missed that.
Yeah, I do. I do.
Okay.
It's tough though. I will say it's tough. Again, throughout all these pictures, I was the only person of color, the only Black woman that was there in these experiences. Yes, I received looks or what some view as microaggressions. Yes, I can tell that due to those feelings, like due to feeling like I was in a fishbowl, I was overcompensating in many different spaces and people pleasing and showing that there's a reason why I'm here, where I later learned that none of that even matters.
Hmm. 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 Okay. You mentioned
Um,
exotics a few minutes ago.
yes, this is actually a picture of me in New Orleans.
Okay.
And I have a baby alligator in my hand. In this photo, this was just something I just wanted to show a picture of me being comfortable with a little bit of everything.
Hmm.
That's part of veterinary medicine, is getting that exposure with everything, finding comfort with everything, and then seeing where you would like to specialize. Um, and so this is just a moment on a or on a boat where I was able to connect with the tour guide and just talk about my experience with reptiles. I actually am a reptile owner myself. No, I don't
Okay.
own an alligator.
What do
No,
you
but
have?
I have a bearded dragon.
Okay.
Yeah,
Okay.
I have a bearded dragon.
Exciting. All right. Here's more reptiles.
More reptiles. So now this is a different phase. So
Okay.
in these pictures, I am actually in my classroom for veterinary technology at
Mhm.
Pima Medical Institute in Houston, Texas.
Mm.
These are corn snakes at the bottom, the orange tangerine colored snakes at the bottom, and then a ball python and the pictures at the top. Those were my coworker, excuse me, my classmates' pets. And this was a day that I actually learned how to determine the sex of a snake.
Okay. How do you
Yeah,
do that?
you use a probe. It's a probe that you insert into the cloaca space,
Mhm.
and the depth in which you're able to advance the probe tells you whether or not you have a male and female.
Okay.
Yeah, very
All right.
interesting.
Yeah. Okay. So this is in Texas. So I didn't mention specifically, but one of the schools that participates in the YVI Book Club and Merit Badge program is in Houston. So I know they're going to be
Wow.
excited. Yeah, they're going to be excited to see this. Okay.
What's going on, Houston? And I'm glad that we're going through these pictures because when I left my college in Louisiana and I started at Pima Medical Institute, I started in the vet assistant portion of the program. And
Hmm.
while I was taking classes, we were letting area hospitals know who we are and what we're trying to do. And so this picture, and I'm gonna get to why I'm talking about
Okay.
this.
Okay.
I was able to meet different practice managers from veterinary practices, general practice, and emergency medicine in Houston at my school. And this was the first time since working at the Animal Control Center, because all I did was volunteer after my animal control experience as a teenager. So from that experience to almost almost 10 years later, I still did not to get the opportunity to work in an animal hospital. So my first job actually came from me meeting my practice manager in the parking lot of my school.
Mhm.
And I just call it an act of desperation or just uh, like divine intervention. But I stopped my practice manager and the lead technician that was with her and said that, look, I'm showing you that I'm in school. I'm showing you that I'm serious. These are my grades. These are my hours. I really want to get into the field in some kind of way. Is there a volunteer space that you have in your hospital? Is there a kennel assistant job that you have in your hospital? I'm willing to do something, but I've been told no many times because I lack small animal experience. And I don't understand, how do I get the experience if no one gives me the opportunity?
Mhm. Exactly.
And I probably said that all in the same breath I did just now. And you know what, Dr. Wells?
What happened?
The next day I had an interview.
Woohoo!
Yeah. And that next week I started as a kennel assistant at Brittmore Animal Hospital in Houston, Texas.
Okay.
Brittmore Animal Hospital was a general practice, uh, but they also did reproduction. They did small animal canine reproduction. So
Mhm.
there I had exposure to collecting, and I have to use these terms. We're talking science, we're talking veterinary medicine. So when
Mhm.
I say reproduction to the youth out there, I'm talking about taking canine pets, your favorite canine pets, and like using multiplicity. There's a way that these pets continue to come generation after generation after generation, and I was a part of that. The
They're
collection
breeding.
process, the breeding,
Yeah.
yes, and testing both the male and the females, testing the males to see if they had viable life forms that would be great candidates for the eggs and the wombs of these canine females. And if uh, the whole breeding process, if we did not need the male and the female present at the time for breeding, we did things surgically.
Mhm.
We did things using endoscopy, trans-cervical insemination.
Mhm.
We also did just old-fashioned what seemed to be like a straw or a plastic tubing and used air.
Okay.
But I it was me speaking out. It was me uh, seeing myself differently. It was me being confident and assertive that opened the door for me to start this practice. I started again as a kennel assistant, and within 2 weeks of that, after working really hard and improving myself, I was able to transfer over to the treatment floor to start as a veterinary assistant.
Okay.
Uh, and then from there, things came in. It's Houston, Texas. So I've seen possum, and then we had a little squirrel that was abandoned, a baby squirrel that was abandoned that came into the hospital this day. And so what you see here is me pictured in general practice, thinking that this was a canine feline practice, and here we go.
Mhm. Okay. It's a squirrel. Okay.
Yeah, baby squirrel, teeny baby squirrel that came in.
Wow. Fab. And what is actually happening in this in the lower left? What are you doing with the squirrel?
So the squirrel, this baby squirrel had eye discharge.
Okay.
And so in this picture, I'm restraining the baby squirrel to remove some of the discharge from the eye so that we
Hmm.
can determine if it's clear, if it is it like over tear production, is it something that we recognize as purulent type discharge
Hmm.
that's thick um,
Hmm.
color and with
Hmm.
odor and things like that. So I was cleaning the
Hmm.
eyes so that the doctor can do further testing if needed.
Okay. So fantastic. All right. Back to
All right.
large.
Yes, back to large. And this is back to my studies. So, my veterinary technology studies at Human Medical Institute were broken down into different categories. We studied emergency medicine, and we studied laboratory animal medicine, and we
Hmm.
also studied equine specifically. And so, this was when we went to an equine practice on the northern side of Houston, Texas. And so this day was able to just become a little bit more comfortable with horses,
Hmm.
learning how to put the lead and halter, which is currently around the horse's face, how to apply that correctly and safely,
Hmm.
how to also do diagnostics. So I learned how to take x-rays on a horse. I learned how to draw blood from a horse, administer vaccines. I even learned how to weigh a horse.
Oh,
Yeah, yeah. Which is not what you would think, Dr. Wells.
okay. Do
Yeah.
you want to share?
Well, there's no scale that you can bring out. Let me say that there's no scale that you can bring out to a field. You can barely bring out X-ray equipment
Hmm.
to the field when it comes to equine medicine. So we use a this like measuring tape.
Uh-huh.
So something very similar to like something that a seamstress would use
Hmm.
to measure around your body, like to measure your waist, measure
Hmm.
your hips and things like that. So we use a long tape and do the math. So
Okay.
math and science here, students. You you're not you will never run away from those things. I tried. Telling you can't. You
Hmm.
can't run away from those things. So we use a measuring tape to measure the girth. And there is a formula out there that when you measure the girth or the main belly portion around a horse, you're able to determine its weight.
Wow. Okay. Let's see, I don't even remember that. I guess because when I was in vet school, well, there was field service, which is when you go out to farms and stuff, but that was only like it was only a very small part of my veterinary education because I wasn't really interested in large animals, so I didn't do a lot of that. So at the hospital where I trained, the horse would come in, and so then you could just trot it over to the scale. So this is very interesting. Thank you for sharing that.
Yeah.
You like horses?
I do like horses. I've learned that it's very difficult and tough to work with horses. As a matter of fact, the I went to go see that equine, or we did different labs with that equine veterinarian, and
Mhm.
one minute I saw the doctor just on an average day. The next time I saw the doctor had bruises and broken her nose because she was um, kicked
Mhm.
by one of her patients, and
Mhm.
things like that happen. Like I call them work tattoos, but they're actually just
Okay.
scars and bite marks
Mhm.
from patients that the only way that they can tell us that they don't want to do what we require of them, they just tell us in the best way they can when we're not listening to all of the many warnings.
Yes,
Yes,
absolutely. And what you
yes,
talked about at the very beginning, learning about animal behavior, being able to observe and interpret correctly what the animal is saying through its body language. And, you know, it's extremely important. All
Very.
right, let me see. I think, yeah, that's the last picture of you with your animals. So this is a photograph. This is not a photograph that Shawntaye gave me. This is a photograph that I have put in to remind me of something. So one of the schools that participates in the Youth Veterinarian Initiative Book Club and Merit Badge Program is in the Bronx, New York. And the teacher, Danielle Corbin, is who you see. She's one of the authors of this book. Tori Ellis is the other author. And you see Danielle Corbin represented in the middle. Her sort of alter ego is Miss Belladonna. And the title of this book is Miss Belladonna's Lab. And so in Miss Belladonna's science class, so Danielle Corbin is a science teacher. She teaches 6th grade. She is really into urban gardening.
Okay.
And the woman who teaches urban gardening, or at least started, was Miss Santana. And Miss Santana's husband is Mr. Paco. And Mr. Paco is a Buddhist, and he teaches mindfulness. And mindfulness is something that you are very passionate about,
Yes.
particularly when it comes to the veterinary workplace. So I would like for you to talk about that now. This slide is to remind me to talk to you about why that is important.
Right. So I'd like to just first give just a general definition of mindfulness. Mindfulness is observation without judgment and attachment.
Mhm.
And I feel that mindfulness is important in our veterinary field because we should be more protective of how attached we get to our patients, how attached we get to the experience of our patients, and how those attachments manifest into unhealthy personal experiences. Um, I can start from just the attachment to defeat, the attachment to disappointment that I had about what I didn't do and didn't complete in my college experience. Had I focused on being attached to being a veterinarian and seeing myself only in that space, I would not be able to enjoy my experience in the space that I was supposed to be in a space that serves me more. Um, Same thing in my field with just like I spoke about with the loss of the little Quaker we saw in the photo. Um, my in our field in general, we deal with death every day, especially in emergency and critical care. In general practice, we there's a different experience, right? There's puppies coming in for vaccines. Owners are happy. Your coworkers, for the most part, are happy and pleased. In emergency medicine, we deal with clients that are afraid and anxious and scared of what's going on. And if you're not firmly rooted in who you are and firmly like grounded, then what they are experiencing is which is being projected into a space can then become attached to you. And so compassion fatigue is something that many people in our field in general experience, but it's something that those that are emergency and critical care, where you may lose a patient. Like last night, I was part of a surgery and my patient did not make it off the surgery table, and if I held on to and allowed myself to be attached to all of those type of experiences, those low vibrational experiences that are not as a result of care that I didn't provide adequately, they weren't a result of my knowledge and skill base. They weren't even a result of support in general. They had nothing to do with me. It was something that was out of my control. But if I focus on the fact that I could have did something better and I could have did this, I could have did that, I could have did this, then I would be ruminating. We saw a large animal. They're called ruminants because they're
Mm-hmm.
chewing cud all the time. So if I
Mm-hmm.
allowed myself to ruminate in that low vibrational space, I would not be healthy enough mentally, emotionally, energetically, and even physically to continue to thrive in this industry. And Dr. Wells, you know that, or you're familiar with the fact that the rate of um, suicide is high in the animal health field,
Mm-hmm.
and it's high in general. It's even higher in the veterinary field, and I know that I am thankful that I found just changing my observation of
Mm-hmm.
my experience to be beneficial to helping me deal with a lot of adversity in our field. There's adversity as with being Black
Mm-hmm.
in general. Is there's adversity with being a Black woman in the field. There's adversity with being a Black woman in leadership. You know, I had those that were welcoming to me when I was just a technician with my head down into my patient. But when I moved into leadership and mentoring, and I was a patient care supervisor at my emergency and critical care practice, veterinary nurse development coordinator, where I trained staff on their skills and hard skills, but soft skills were important to me.
Mm-hmm.
What is your mindset? How do you see yourself as thriving rather than surviving in this field?
Mm-hmm.
Those things are important to me. Um, Mindfulness, how I manifest mindfulness daily on my shift is going in with the reminder that I am only in control of my own thoughts, speech, and actions, nothing else.
Mm-hmm.
Um, I also go into my shift with setting intentions. Like my intention is to be seen and heard. My
Okay.
intention is to ensure that if I desire to be seen and heard, I want my patients to be seen and heard. I also want my coworkers to be seen and heard.
Mm-hmm.
Just a second ago, I was saying that everyone was cool with the fact that, oh, she's a technician, her head is down. But when I looked up and I saw how people were being treated, like how coworkers were treating coworkers, no matter what your title is, whether you're a veterinarian, whether you're a veterinary technician, whether you're a veterinary assistant, a receptionist,
Mm-hmm.
when I saw how people were being treated, um, and how they weren't supported, when I saw that it was kind of like dog eat dog in our industry where it was sink or swim, you know, the pictures, the pictures of like, I look like I'm smiling a lot of those pictures, but I remember walking onto the floor when I transitioned from a kennel assistant to a veterinary assistant. And I had a coworker who expected me to be able to draw blood and restrain the animal properly, and yelled at me, and then made fun of me because they felt like, well, aren't you in school? Shouldn't you know this already?
Oh.
So mindfulness was really important to me so that I don't see myself as less than on a daily basis.
Okay. This is
So
so,
that,
so, so important.
yeah, especially for um, these times, you know, like mindfulness helped me to not be numb, but learn how to detach myself
Mm-hmm.
in a healthy way.
Yeah. And there's a very important distinction there. You
Yeah,
can be detached and still care. You can be detached and still care. Yeah.
absolutely.
This is
Boundaries,
yes. This is
knowing,
fabulous.
yeah, saying
This is
no.
fabulous. Yes.
All of those things are
Yes.
important. I went through a lot of my emergency and critical care career saying yes to everything, which
Mm-hmm.
meant saying no to taking a breath, saying no to drinking water, saying no to eating a meal
Mhm.
in a timely fashion. And I paid for those things,
Mhm. Mhm.
basically.
Yes. Yes. It's so the last thing that I want to ask you, because we're coming up to the top of the hour, is I want you to just talk a little bit about the veterinary technician curriculum and talk about whether mindfulness is actually a part of it or whether you have to bring that in for yourself.
I will say that the veterinary technician curriculum is only focused on hard skills.
Okay.
Hard skills meaning knowing the science behind disease processes, science behind your pharmacology, knowing your instruments, knowing your restraint, knowing how to ask the appropriate questions so that the doctors have a greater awareness of how to diagnose, prognose, and perform other things. There's nothing in the curriculum that I experienced before when I was in school about mindfulness. And all of those things are things that you have to find for yourself. I was introduced to a lot of these things because I'm a registered yoga teacher. I am also a student of metaphysical science and African spirituality. And so those things are what I bring into my hospital with meditations, affirmations, words of power, um, knowing signs when I have to tell a coworker, hey, you might need to go sit down.
Mhm.
Those are things, so I call those the soft skills, the self-compassion, forgiveness. Self-forgiveness is really important in this industry.
Mhm. Mhm. Yes.
Your voice, those are things that no one is going to immediately teach you in a lot of professional industries because honestly, it's not important to the higher ups.
Mhm.
Production is more important to higher ups. So you have to grow your awareness now, and you have to integrate those things that you learn into your occupation so that it can be occupational wellness.
Yes. Beautiful. All right. I think with that, we are going to conclude. This has been very powerful. It's been fun. I hope you've enjoyed it.
I have. Thank you, Dr. Wells. I appreciate it.
Oh my goodness. So, as usual, this this session is being recorded, and as soon as we disconnect, the recording will render, and I will upload it to YouTube, and I will make the link available to the world so that those who are not able to join us today will be able to benefit from all of your wisdom and experience, and hopefully will reach out and say, maybe I can be a vet tech. And could I reach out to Shawntaye Thomas-Dalton and ask her a few questions myself?
Absolutely. Absolutely. As a matter of fact, you can reach out to me just with my basic email address, shawntayethomas@gmail.com. I also have a LinkedIn page, so we'll be able to provide those links for you. And I'm coming out as a veterinary team coach. Like I do want to teach people about having mindfulness, integrating those things, and gaining that skills, knowledge, and critical thinking that is so important to your career. So I'm here to help everybody.
All right, that is fantastic. Whew. All right, episode 35 coming to an end. Thank you so much, Shawntaye. It has been a pleasure and a privilege. And I will see everybody next time on the YVI podcast. Saying bye from Paris for now.
Thank you. Thank you.
Bye bye.